Hi guys, welcome back. So we all know that heat wave is at its peak and there are a lot of bad effects of this heat that people are suffering. In our previous video, we have seen simple hacks to apply in day-to-day life to protect ourselves from these bad effects. But what happens when you can't really protect yourself and this heat takes a toll on you? Yes. So that is when the condition is called heat stroke, and lot of people in India today are suffering with heat stroke. So firstly, how to diagnose heat stroke, because it is a medical emergency and a patient needs to be immediately given a medical attention. So firstly, diagnose it correctly. So simplest thing that we get to see is increased irritability, inability to concentrate, think clearly, mental fatigue, dizziness, fainting, palpitation, anxiety. All these suddenly built up in a person. The skin gets very dry and red. Eyes, nasal mucous membrane, the inside skin of nose also becomes very dry. Your mouth gets very dry. Sometimes it causes breathing difficulty. Yes, because of the heat, there can be breathing difficulty. Then a person can develop fever. The fever goes up to 104 many a times. So that is an effect or a sign of heat stroke. Person also develops a bad headache, vomiting, nausea, uneasiness. Urine output suddenly reduces. So how much ever water the person is drinking, there is not enough urine produced. It is not proportionate. Muscles go into cramp. There is weakness and pain in the muscles of all across the body. In extreme cases, there can be seizures or fits. There can be bleeding from anywhere on the body. So all these are classic signs of heat stroke. Like I said, it is a medical emergency and a patient needs to get medical attention as soon as possible. But till you take patient to the doctor or ambulance reaches to the location, there are few simple things that you can do that can help the patient. So at this time, make patient lie down. If patient is wearing very tight clothes, then loosen the clothes. Do not crowd up around the patient. Patient needs to get a lot of air as much as possible. So don't let crowd obstruct the air. Also, if you have towel or stroll or any kind of cloth with you, then wet the cloth, dupatta maybe. Wet this cloth and keep it around patient's neck and throat, also on the body. Apply a lot of cold water to the head on vertex and to the face so that temperature really comes down. Our body's temperature center is right behind under our head at medulla oblongata. So when we apply a lot of cold water or a damp cloth to this part, it helps regulating the temperature. So the effects of heat stroke can be reduced, because with excessive impact of heat stroke, patient can go into cardiac issues and it can be life-threatening as well. So all these are hacks to apply while you transport the patient to hospital or till the doctor reaches. These are not the things that you can do to avoid medical attention. Remember that. Anybody who suffers a heat stroke needs to get medical attention for sure. Hydrate the patient as much as possible so that internally temperature cools down a little. So these are all the precautions that you can take if somebody suffers with heat stroke. But guys, try doing the hacks that we have told you in previous video so that it doesn't reach to this level. It doesn't reach to the level of getting heat stroke. Stay safe, stay indoors, and take care of yourself. Thank you.